Works, but Congress is facing a new battle and a new deadline, the extension of Affordable Care Act funding. Around 100,000 Nevadans may see their premiums rise. Well, tonight, News 3 taking a closer look at those numbers, along with who would be affected and when. Our Will Silverstein spent the day crunching the numbers for us, and he joins us now from Foley Federal Building in downtown Las Vegas with the very latest. And Will, folks are now already sharing their quotes that they're getting on social media as of right now. And what have you been seeing?
Yeah, they're sharing their posts on social media and sharing those quotes there, mostly because this is a younger generation of people. We're talking about people that their first time that they may be paying for health insurance, maybe in the era when they had these subsidies existing for them. That era may be expiring soon, in part because this, as you had just mentioned there, LaToya, the ACA not included in part of this government shutdown deal that was approved by Nevada Democratic Senators Catherine Cortez Masto and Jacky Rosen. They both do suggest still that healthcare remains a priority.
This is an all of us problem, and it's a right now problem.
With an emphasis on the right now, open enrollment has begun across the country and right here in Nevada. The period runs from now until January 15th, but many are wondering if their premiums will be on the rise before then, as Affordable Care Act subsidies will expire on December 31st. That invokes worry on Capitol Hill for Nevada Senator Jacky Rosen.
Accident or an illness can change your life in an instant, and if you don't have health care, not only lose your life, you could go bankrupt. It's horrific.
And it may be horrifically expensive. Here are a handful of plans compiled by consumer watchdog healthinsurance.org showing several carriers dealing with increased prices by the tune of more than 15%. People are seeing hits in real time too as the deadline approaches. Take a look here at this post making the rounds on Las Vegas social media groups, supposedly showing a $1,000 premium on a policy for a 21-year-old's family and a multi-$100 premium for his individual plan. Commenters suggesting that this person is getting the welcome treatment to expensive health care, some wishing their premiums were lower, others saying the money they pay for insurance is better spent elsewhere, and even dropping the provider. Nevada Senator Catherine Cortez Masto says Republicans have a chance to continue to subsidize the Affordable Care Act to keep premiums like ones you just saw at lower levels.
If they're not true to their word, then they own it. If the Republicans don't care about Americans' health care in this country and lowering costs, then they own it. Then it's on them.
The Democrats will never acknowledge that Obamacare has been an unmitigated disaster.
But Republicans in Congress are likely to vote down the continuation of the subsidies, according to Republican consultant Matt Klink. He says the GOP will be looking to retool the insurance marketplace altogether and potentially eliminate the Affordable Care Act.
It can't be fixed. It needs to be scrapped and it needs to be started over again.
However, the question is what happens when the push comes to shove and healthcare premiums for millions are likely on the rise in a year where Americans hit the polls next fall. Is it a bad look, though, in an election year?
No, it's not a bad look for Republicans to not continue to extend COVID subsidies that go to people making $500,000 for healthcare costs. What Republicans need to sell is that temporary means temporary.
Senator Cortez Masto holding on to hope for a deal.
Listen, we are going to have to come together and negotiate. That's the nature of what the Senate does. There's no guarantee on anything that we do here.
And speaking of no guarantees, that shutdown deal is still just in the works right now, not approved yet. It has to be approved by the House, then goes up to the president to sign. And then that debate is just that on the ACA. It is still a debate. That vote that we heard Senator Rosen talk about, still scheduled for sometime mid-December. Just that if you think about maybe mid-December, December 16th, that's only 15 days before those subsidies could expire.
Yeah, and folks are signing up right now. As we know, the open enrollment period is happening right now. Well, if people want to enroll or want some more information before doing so, where should they go?
They should go to NevadaHealthLink.com, and if they can't find NevadaHealthLink.com, they should go to our website, news3lv.com. We have a link to take you over there, and then that is where you can compare those different insurance rates. That's how you can speak with somebody online and figure out maybe what works best for you and maybe what's best for the future, although, as we know, the future is a bit uncertain.
Yeah, uncertain, especially when you see your premiums go up 100%. Thank you so much. Well, as Congress haggles over what to do about health care, data over the last several years shows insurance costs are skyrocketing. According to research firm the Kaiser Family Foundation, KFF, the average family in the U.S. currently pays more than $6,800 annually for coverage. The average for their employers, well, $20,000 per family. Back in 1999, employers only paid $4,200 and their families paid $1,500.